Our last component of our movement examination is the passive accessory motions. As with the others, the purpose of the passive accessory movement is to identify the concordant sign of the patient. We will actually go in and push passively on the multiple joints that are in the thoracic region to see if it reproduces the concordant sign of the patient. A positive finding may be suggestive of a proper treatment, especially if you believe in the concept that passive accessory findings in which change during your examination and have a carryover change into the next examination lead to positive functional outcomes if a manual therapy approach is applied. Why do I believe in that concept? Well, there are several studies that have actually shown that that is to be the case, that a precursor passive accessory finding of pain, that if you treat it and it gets a little bit better and it has carryover for the next visit, that is suggestive that the patient is going to do well in the long run. There are a number of techniques we can use. We can do central posterior anteriors, or CPAs, and these are passive accessories performed directly to the spinous process of the patient in the thoracic spine. Because the thoracic spine is so large, you often want to target the area where the patient identifies their primary complaint is and then work outward. I work up and I'll work down with a goal to target the area that is most concordant. So if I'm working on T4, the patient says, yeah, that's painful, sorta. I might check T5, I might check T3. It could be that one of those is more painful than the T4 process. I can also perform a unilateral posterior anterior on the facets. The facets are located just next to the spinous processes, and they're actually a dip within the skeleton. You can use your thumb to stick over the facet and apply a downward push, and you use the same concept that you do on your CPAs. You push until you find the area that is most concordant, and then you will repeat that motion or use sustained holds to see if it makes a difference in that patient. Your goal is to reduce the pain and improve the movement of the patient with your assessment approach. The techniques that we use later for treatment are going to look very similar to your assessment methods, and that's the real beauty of it. There's carryover. That's the patient response method. Very similar to a Maitland concept or a McKenzie concept, is there's carryover from the examination to the treatment.